We're talking about intra-articular therapies, and there's been a couple of questions about knowing how and when to combine different things. So if we use an example, let's say the hydrogel or anything else intra-articularly, how do we combine this with other things? Is there a rule of thumb or any kind of logic into how we approach this?
Yes, so I think the ethical and the logical approach to most of these intra-articular therapies is to leave our patients on the current therapy that they're on, and then we inject, let's say, Arthrimid or one of the others, and then assess them. And when they look like they're doing well, then try to systematically decrease some of the other therapies, especially something like an NSAID, because these are like, if we're using a number of these products that are inducing an anti-inflammatory effect, maybe we don't need an NSAID anymore. And so trying to decrease it once again in a systematic, logical manner so we can see the lowest effective dose, and maybe that lowest effective dose is 0, or maybe it's a quarter of the NSAID dose. So, but I don't try to decrease something until I know the patient has improved. So the good thing is all of these therapies are compatible with our common oral therapy.
Okay, another question related to this just came in. Is there any added benefit of using platelet-rich plasma in conjunction with stem cells?
So that's a great question because I do that a lot because there is at least one small paper in dogs that shows that the combination of platelet-rich plasma with stem cells may be better than either of them by themselves.
Mhm.
And I know Dr. Bartling is raising her hand over there.
Yes, thank you for including me. I wanted to chime in just in terms of strategy, and Dr. Gaynor, you talk about strategy in such an eloquent way. I am an old sport horse doctor, and so I'm so comfortable with joint injections and therapy and regular keeping up on cushioning in joints to prevent pain and degradation in joints. And so I think it's important that we talk about the kind of the strategy of this, which you have a whole lecture about, but to choose products to combine together to make sure we're addressing the pain, that we're controlling the inflammation, and that we're doing something about the intra-articular physics that create destruction. And then I have to mention, yes, of course, taking care of the muscles and tendons outside the joints and then building strength with rehab as a big picture plan. It's important that as we're combining these things, that we have a strategy that is encompassing all of the individual pieces.
Well, I'm glad you mentioned that because really a very common protocol for me now, and this could include stem cells, but for patients who aren't getting stem cells, is a combination of Cinnamid or Arthrimid as an anti-inflammatory, hyaluronic acid as a lubricant, and Spring as my osteocushioning. And then in our big picture, as we get patients comfortable, exactly like you said, then we start taking care of building muscle mass. Because in a lot of our patients, we can get rid of the pain, but if they're weak, they're still dysfunctional. And so I'm glad you brought that up because osteoarthritis care is more than just pain management. It's really musculoskeletal care.